My pathology topic is coronavirus disease. Severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2, is now known as COVID-19. This virus was first detected in Wuhan, China, in December 2019, but by March of 2020, the World Health Organization declared COVID-19 a global pandemic. It is the fifth pandemic since the 1918 flu pandemic, but the first one caused by a coronavirus. All of the other pandemics have been caused by influenza viruses. The novel coronavirus is a spherical RNA virus with projections on its surface. COVID-19 causes respiratory illness ranging from asymptomatic infection to life-threatening and fatal disease. COVID-19 is spread from person to person by aerosol droplets. All age groups are susceptible to COVID-19, but the elderly, 65 and above, are at the greatest risk of developing severe disease. Respiratory illness presents as fever, cough, and shortness of breath, but COVID-19 also affects the heart and the brain, and it can cause long-term illness. To date, there are over 50 million cases worldwide and just over 10 million cases in the United States, with approximately 240,000 deaths in the US since February of 2020. New cases in the US have been increasing daily, as shown in the chart from the New York Times. The Center for Disease Control and Prevention recommends all people wear a mask covering their mouth and nose, as shown in the photo. They also recommend to avoid large gatherings and to practice social distancing, staying 6 feet apart from others. Personal protective equipment, PPE, in the hospital setting is required to prevent patient-to-staff cross-infection. The PPE required are disposable isolation gowns, N95 masks, face shields, and gloves. The PPE diagram included here is from the CDC. Donning and doffing procedures should be posted in all departments with COVID-19 patients. Diagnosis is made based on symptoms, history of exposure, and radiological exams such as chest x-rays and chest CTs. Certain analytical tests are also used, but the most definitive is the RT-PCR test, which uses a nasopharyngeal swab to collect a sample from deep within the patient's nose. Chest x-rays and chest CTs both show ground glass opacities in the lower lung. COVID-19 typically affects the peripheral lung areas in both lungs. It is distinctively bilateral on the exams, as shown by the yellow arrows. Treatment for COVID-19 varies based on severity of symptoms, especially once the patient is hospitalized. When supplemental oxygen is needed in milder cases, non-invasive ventilation is used, as highlighted by the blue arrow. Treatment may also include IV antiviral. Remdesivir is most commonly used, and IV corticosteroids. Dexamethasone is frequently used in combination with the antiviral treatment. Severe ICU cases require invasive mechanical ventilation. See the red arrow in the attached diagram from the BBC News. Mechanical ventilation provides oxygen without relying on the patient's lungs, as it is too difficult for them to draw adequate breath to maintain necessary oxygen levels. The IV antiviral and corticosteroid are continued in these patients. When the New York City area was a COVID-19 hotspot, as much as 50% of the hospitalized patients died from the disease. The highest percentage of these were men over 60 with comorbidities such as obesity, asthma, and diabetes. More recently, a younger population with fewer comorbidities have been hospitalized. This changing population and the new drug therapy combinations have reduced fatality rates to approximately 8% in the same metropolitan area, as shown in the last chart. COVID-19 continues to represent an unprecedented, widespread health threat in the United States as infections, hospitalizations, and deaths continue to increase.